5.3.6 Cumulative Analysis of Post-Authorization Adverse Event Reports of PF 7,302,048 BNT 162B2 received through 28 Feb 2021. Report prepared by Worldwide Safety, Pfizer. Introduction. Reference is made to the request for comments and advice submitted February 4, 2021 regarding Pfizer/BioNTech's proposal for the clinical and post-authorization safety data package for the Biologics License Application (BLA) for our investigational COVID-19 vaccine, BNT 162B2. Further reference is made to the agency's March 9, 2021 response to this request, and specifically, the following request from the agency. Monthly safety reports primarily focus on events that occurred during the reporting interval and include information not relevant to a BLA submission such as line lists of adverse events by country. We are most interested in a cumulative analysis of post-authorization SAE data to support your future BLA submission. Please submit an integrated analysis of your cumulative post-authorization safety data, including U.S. and foreign post-authorization experience, in your upcoming BLA submission. Please include a cumulative analysis of the important identified risks, important potential risks, and areas of important missing information identified in your pharmacovigilance plan, as well as adverse events of special interest and vaccine administration errors, whether or not associated with an adverse event. Please also include distribution data and an analysis of the most common adverse events. In addition, please submit your updated pharmacovigilance plan with your BLA submission. A to Z list of Pfizer COVID-19 vaccine side effects. Appendix 1. List of adverse events of special interest. 1p36 deletion syndrome. 2 hydroxyglutaric aciduria. 5 nucleotidase increased. Acoustic neuritis. Acquired C1 inhibitor deficiency. Acquired epidermolysis bullosa. Acquired epilephasia. Acute cutaneous lupus erythematosus. Acute disseminated encephalomyelitis. Acute encephalitis with refractory. Repetitive partial seizures. Acute febrile neutrophilic dermatosis. Acute flaccid myelitis. Acute hemorrhagic leukoencephalitis. Acute hemorrhagic edema of infancy. Acute kidney injury. Acute macular outer retinopathy. ACI motor axonal neuropathy. Acute motor sensory axonal neuropathy. Acute myocardial infarction. Acute respiratory distress syndrome. Acute respiratory failure. Addison's disease. Administration site thrombosis. Administration site vasculitis. Adrenal thrombosis adverse event following immunization. Ageusia. Agranulocytosis. Air embolism. Alanine aminotransferase abnormal. Alanine aminotransferase increased. Alcohol. Seizure. Allergic bronchopulmonary mycosis. Allergic edema. Alloimmune hepatitis. Alopecia areata. Alpers disease. Alveolar proteinosis. Ammonia abnormal. Ammonia increased. Amniotic cavity infection. Amygdalocapocompectomy. Amyloid arthropathy. Amyloidosis. Amyloidosis senile. Anaphylactic reaction. Anaphylactic shock. Anaphylactic transfusion reaction. Anaphylactoid reaction. Anaphylactoid shock. Anaphylactoid syndrome of pregnancy. Angioedema. Angiopathic neuropathy. Ankylosing spondylitis. Anosmia. Anti-acetylcholine receptor antibody positive. Anti-actin antibody positive. Anti-aquaporin-4 antibody positive. Anti-basal ganglia antibody positive. Anti-cyclic citrullinated peptide antibody positive. Anti-epithelial antibody positive. Anti-erythrocyte antibody positive. Anti-exosome complex antibody positive. Anti-GAD antibody negative. Anti-GAD antibody positive. Anti-ganglioside antibody positive. Anti-gliadin antibody positive. Anti-glomerular basement membrane antibody positive. Anti-glomerular basement membrane disease. Anti-glycyl tRNA synthetase antibody positive. Anti-HLA antibody test positive. Anti-EO2 antibody positive. Anti-insulin antibody increased. Anti-insulin antibody positive. Anti-insulin receptor antibody increased. Anti-insulin receptor antibody positive. Anti-interferon antibody negative. Anti-interferon antibody positive. Anti-islet cell antibody positive. Antimitochondrial antibody positive. Anti-muscle specific kinase antibody positive. Anti-myelin associated glycoprotein antibodies positive. Anti-myelin associated glycoprotein associated polyneuropathy. Antimyocardial antibody positive. Anti-neuronal antibody positive. Antineutrophil cytoplasmic antibody increased. Antineutrophil cytoplasmic antibody positive. Antineutrophil cytoplasmic antibody positive vasculitis. Anti-NMDA antibody positive. Antinuclear antibody increased. Antinuclear antibody positive. Antiphospholipid antibodies positive. Antiphospholipid syndrome. Antiplatelet antibody positive. Antiprothrombin antibody positive. Antiribosomal P antibody positive. Anti-RNA polymerase II antibody positive. Anti-Saccharomyces cerevisiae antibody test positive. Anti-sperm antibody positive. Anti-SHRP antibody positive. Antisynthetase syndrome. Anti-thyroid antibody positive. Anti-transglutaminase antibody increased. Anti-VGCC antibody positive. Anti-VGKC antibody positive. Anti-vimentin antibody positive. Antiviral prophylaxis. Antiviral treatment. Anti-zinc transporter 8 antibody positive. Aortic embolus. Aortic thrombosis. Aortitis. Aplasia pure red cell. Aplastic anemia. Application site thrombosis. Application site vasculitis. Arrhythmia. Arterial bypass occlusion. Arterial bypass thrombosis. Arterial thrombosis. Arteriovenous fistula thrombosis. Arteriovenous graft site stenosis. Arteriovenous graft thrombosis. Arteritis. Arteritis. Arteritis coronary. Arthralgia. Arthritis. Arthritis enteropathic. Ascites. Aseptic cavernous sinus thrombosis. Aspartate aminotransferase abnormal. Aspartate aminotransferase increased. Aspartate glutamate transporter deficiency. AST to platelet ratio index increased. AST/ALT ratio abnormal. Asthma. Asymptomatic COVID-19. Ataxia. Atherombolism. Atonic seizures. Atrial thrombosis. Atrophic thyroiditis. Atypical benign partial epilepsy. Atypical pneumonia. Aura. Autoantibody positive. Autoimmune anemia. Autoimmune aplastic anemia. Autoimmune arthritis. Autoimmune blistering disease. Autoimmune cholangitis. Auto-1 immune colitis. Autoimmune demyelinating disease. Autoimmune dermatitis. Autoimmune disorder. Autoimmune encephalopathy. Autoimmune endocrine disorder. Autoimmune enteropathy. Autoimmune A disorder. Autoimmune hemolytic anemia. Autoimmune heparin-induced thrombocytopenia. Autoimmune hepatitis. Autoimmune hyperlipidemia. Autoimmune hypothyroidism. Autoimmune inner ear disease. Autoimmune lung disease. Autoimmune lymphoproliferative syndrome. Autoimmune myocarditis. Autoimmune myositis. Autoimmune nephritis. Autoimmune neuropathy. Autoimmune neutropenia. Autoimmune pancreatitis. Autoimmune pancytopenia. Autoimmune pericarditis. Autoimmune retinopathy. Autoimmune thyroid disorder. Autoimmune thyroiditis. Autoimmune uveitis. Autoinflammation with infantile enterocolitis. Autoinflammatory disease. Automatism epileptic. Autonomic nervous system imbalance. Autonomic seizure. Axial spondyloarthritis. Axillary vein thrombosis. Axonal and demyelinating polyneuropathy. Axonal neuropathy. Bactricites. Baltic myoclonic epilepsy. Band sensation. Basedow's disease. Basilar artery thrombosis basiphilipenia. B-cell aplasia. Behçet's syndrome. Benign ethnic neutropenia. Benign familial neonatal convulsions. Benign familial pemphigus. Benign Roland-Dick epilepsy. Beta-2 glycoprotein antibody positive. Bickerstaff's encephalitis. Bile output abnormal. Bile output decreased. Biliary ascites. Bilirubin conjugated abnormal. Bilirubin conjugated increased. Bilirubin urine present. Biopsy liver abnormal. Biotinidase deficiency. Birdshot chorioretinopathy. Blood alkaline phosphatase abnormal. Blood alkaline phosphatase increased. Blood bilirubin abnormal. Blood bilirubin increased. Blood bilirubin unconjugated increased. Blood cholinesterase abnormal. Blood cholinesterase decreased. Blood pressure decreased. Blood pressure diastolic decreased. Blood pressure systolic decreased. Blue toe syndrome. Brachiocephalic vein thrombosis. Brainstem embolism. Brainstem thrombosis. Ramosyl-Foline test abnormal. Bronchial edema. Bronchitis. Bronchitis mycoplasmal. Bronchitis viral. Bronchopulmonary aspergillosis allergic. Bronchospasm. Budd-Chiari syndrome. Bulbar palsy. Butterfly rash. C1q nephropathy. Caesarean section calcium embolism. Capillaritis. Kaplan syndrome. Cardiac amyloidosis. Cardiac arrest. Cardiac failure. Cardiac failure acute. Cardiac sarcoidosis. Cardiac ventricular thrombosis. Cardiogenic shock. Cardiolipin antibody positive. Cardiopulmonary failure. Cardiorespiratory arrest. Cardiorespiratory distress. Cardiovascular insufficiency. Carotid arterial embolus. Carotid artery thrombosis. Cataplexy. Catheter site thrombosis. Catheter site vasculitis. Cavernous sinus thrombosis. CDKL5 deficiency disorder. CEC syndrome. Cement embolism. Central nervous system lupus. Central nervous system vasculitis. Cerebellar artery thrombosis. Cerebellar embolism. Cerebral amyloid angiopathy. Cerebral arteritis. Cerebral artery embolism. Cerebral artery thrombosis. Cerebral gas embolism. Cerebral microembolism. Cerebral septic infarct. Cerebral thrombosis. Cerebral venous sinus thrombosis. Cerebral venous thrombosis. cerebrospinal thrombotic tamponade, cerebrovascular accident, change in seizure presentation, chest discomfort, child Pugh-Turcotte score abnormal, child Pugh-Turcotte score increased, chilblains, choking, choking sensation, cholangitis sclerosing, chronic autoimmune glomerulonephritis, chronic cutaneous lupus erythematosus, chronic fatigue syndrome, chronic gastritis, chronic inflammatory demyelinating polyradiculoneuropathy, chronic lymphocytic inflammation with pontine perivascular enhancement responsive to steroids, chronic recurrent multifocal osteomyelitis, chronic respiratory failure, chronic spontaneous urticaria, circulatory collapse, circumoral edema, circumoral swelling, clinically isolated syndrome, clonic convulsion, celiac disease, Cogan's syndrome, cold agglutinins positive, cold type hemolytic anemia, colitis, colitis erosive, colitis herpes, colitis microscopic, colitis ulcerative, collagen disorder, collagen vascular disease, complement factor abnormal, complement factor C1 decreased, complement factor C2 decreased, complement factor C3 decreased, complement factor C4 decreased, complement factor decreased, computerized hemogram liver abnormal, concentric sclerosis, congenital anomaly, congenital bilateral perisylvian syndrome, congenital herpes simplex infection, congenital myasthenic syndrome, congenital varicella infection, congestive hepatopathy, convulsion in childhood, convulsions local, convulsive threshold lowered, Coombs positive hemolytic anemia, coronary artery disease, coronary artery embolism, coronary artery thrombosis, coronary bypass thrombosis, coronavirus infection, coronavirus test negative, coronavirus test positive, corpus callosotomy, cough, cough variant asthma, COVID-19, COVID-19 immunization, COVID-19 pneumonia, COVID-19 prophylaxis, COVID-19 treatment, cranial nerve disorder, cranial nerve palsies multiple, cranial nerve paralysis, Crest syndrome, Crohn's disease, cryofibrinogenemia, cryoglobulinemia, CSF oligoclonal band present, CSWS syndrome, cutaneous amyloidosis, cutaneous lupus erythematosus, cutaneous sarcoidosis, cutaneous vasculitis, cyanosis, cyclic neutropenia, cystitis interstitial, cytokine release syndrome, cytokine storm, de novo purine synthesis inhibitors associated acute inflammatory syndrome, death neonatal, deep vein thrombosis postoperative, deficiency of bile secretion, déjà vu, demyelinating polyneuropathy, demyelination, dermatitis, dermatitis bullous, dermatitis herpetiformis, dermatomyositis, device embolization, device-related thrombosis, diabetes mellitus, diabetic ketoacidosis, diabetic mastopathy, dialysis amyloidosis, dialysis membrane reaction, diastolic hypotension, diffuse vasculitis, digital pitting scar, disseminated intravascular coagulation, disseminated intravascular coagulation in newborn, disseminated neonatal herpes simplex, disseminated varicella zoster vaccine virus infection, disseminated varicella zoster virus infection, DNA antibody positive, double cortex syndrome, double-stranded DNA antibody positive, dreamy state, Dressler's syndrome, drop attacks, drug withdrawal convulsions, dyspnea, early infantile epileptic encephalopathy with burst suppression, eclampsia, eczema herpeticum, embolia cutis medicamentosa, embolic cerebellar infarction, embolic cerebral infarction, embolic pneumonia, embolic stroke, embolism, embolism arterial, embolism venous, encephalitis, encephalitis allergic, encephalitis autoimmune, encephalitis brainstem, encephalitis hemorrhagic, encephalitis periaxialis diffusa, encephalitis post-immunization, encephalomyelitis, encephalopathy, endocrine disorder, endocrine ophthalmopathy, endotracheal intubation, enteritis, enteritis leukopenic, enterobacter pneumonia, enterocolitis, enteropathic spondylitis, eosinopenia, eosinophilic fasciitis, eosinophilic granulomatosis with polyangiomitis, eosinophilic esophagitis, epidermolysis, epilepsy, epilepsy surgery, epilepsy with myoclonic atonic seizures, epileptic aura, epileptic psychosis, erythema, erythema induratum, erythema multiforme, erythema nodosum, Evans syndrome, exanthema subitum, expanded disability status scale score decreased, expanded disability status scale score increased, exposure to communicable disease, exposure to SARS-CoV-2, eye edema, eye pruritus, eye swelling, eyelid edema, face edema, facial paralysis, facial paresis, Facial dystonic seizure. Fat embolism, febrile convulsion. Febrile infection-related epilepsy syndrome. Febrile neutropenia. Feltes syndrome. Femoral artery embolism. Fibrillary glomerulonephritis. Fibromyalgia. Flushing. Foaming at mouth. Focal cortical resection. Focal dyscognitive seizures. Fetal distress syndrome. Fetal placental thrombosis. Fetal hepatitis. Foreign body embolism. Frontal lobe epilepsy. Fulminant type 1 diabetes mellitus. Galactose elimination capacity test abnormal. Galactose elimination capacity test decreased. Gamma glutamyltransferase abnormal. Gamma glutamyltransferase increased. Gastritis herpes. Gastrointestinal amyloidosis. Gelastic seizure. Generalized onset non-motor seizure. Generalized tonic-clonic seizure. Genital herpes. Genital herpes simplex. Genital herpes zoster. Giant cell arteritis. Glomerulonephritis. Glomerulonephritis membranoproliferative. Glomerulonephritis membranous. Glomerulonephritis rapidly progressive glossopharyngeal nerve paralysis. Glucose transporter type deficiency syndrome. Glutamate dehydrogenase increased. Glycolic acid increased. GM2 gangliosidosis. Goodpastures syndrome. Graft thrombosis. Granulocytopenia. Granulocytopenia neonatal. Granulomatosis with polyangiitis. Granulomatous dermatitis. Gray matter heterotopia. Guanus increased. Guillain-Barré syndrome. Hemolytic anemia. Hemophagocytic lymphohistiocytosis. Hemorrhage. Hemorrhagic ascites. Hemorrhagic disorder. Hemorrhagic pneumonia. Hemorrhagic varicella syndrome. Hemorrhagic vasculitis. Hantavirus pulmonary infection. Hashimoto's encephalopathy. Haschitic psychosis. Hemimegalencephaly. Lenox-Sconlin purpura. Lenox-Sconlin purpura nephritis. Hepaplastin abnormal. Hepaplastin decreased. Heparin-induced thrombocytopenia. Hepatic amyloidosis. Hepatic artery embolism. Hepatic artery flow decreased. Hepatic artery thrombosis. Hepatic enzyme abnormal. Hepatic enzyme decreased. Hepatic enzyme increased. Hepatic fibrosis marker abnormal. Hepatic fibrosis marker increased. Hepatic function abnormal. Hepatic hydrothorax. Hepatic hypertrophy. Hepatic hypoperfusion. Hepatic lymphocytic infiltration. Hepatic mass. Hepatic pain. Hepatic sequestration. Hepatic vascular resistance increased. Hepatic vascular thrombosis. Hepatic vein embolism. Hepatic vein thrombosis. Hepatic venous pressure gradient abnormal. Hepatic venous pressure gradient increased. Hepatitis. Hepatobiliary scan abnormal. Hepatomegaly. Hepatosplenomegaly. Hereditary angioedema with C1 esterase inhibitor deficiency. Herpes dermatitis. Herpes gestationis. Herpes esophagitis. Herpes ophthalmic. Herpes pharyngitis. Herpes sepsis. Herpes simplex. Herpes simplex cervicitis. Herpes simplex colitis. Herpes simplex encephalitis. Herpes simplex gastritis. Herpes simplex hepatitis. Herpes simplex meningitis. Herpes simplex meningoencephalitis. Herpes simplex meningomyelitis. Herpes simplex necrotizing retinopathy. Herpes simplex oxophagitis. Herpes simplex otitis externa. Herpes simplex pharyngitis. Herpes simplex pneumonia. Herpes simplex reactivation. Herpes simplex sepsis. Herpes simplex viremia. Herpes simplex virus conjunctivitis neonatal. Herpes simplex visceral. Herpes virus infection. Herpes zoster. Herpes zoster cutaneous disseminated. Herpes zoster infection neurological. Herpes zoster meningitis. Herpes zoster meningoencephalitis. Herpes zoster meningomyelitis. Herpes zoster meningoradiculitis. Herpes zoster necrotizing retinopathy. Herpes zoster oticus. Herpes zoster pharyngitis. Herpes zoster reactivation. Herpetic radiculopathy. Histamine antibody positive. Hoynes syndrome. Human herpes virus 6 encephalitis. Human herpes virus 6 infection. Human herpes virus 6 infection reactivation. Human herpes virus 7 infection. Human herpes virus 8 infection. Hyperammonemia. Hyperbilirubinemia. Hypercholia. Hypergammaglobulinemia benign monoclonal. Hyperglycemic seizure. Hypersensitivity. Hypersensitivity vasculitis. Hyperthyroidism. Hypertransaminosemia. Hyperventilation. Hypoalbuminemia. Hypocalcemic seizure. Hypogammaglobulinemia. Hypoglossal nerve paralysis. Hypoglossal nerve paresis. Hypoglycemic seizure. Hyponatremic seizure. Hypotension. Hypotensive crisis. Hypothalamus syndrome. Hypothyroidism. Hypoxia. Idiopathic CD4 lymphocytopenia. Idiopathic generalized epilepsy. Idiopathic interstitial pneumonia. Idiopathic neutropenia. Idiopathic pulmonary fibrosis. L-GAD nephropathy. IgM nephropathy. Third nerve paralysis. ILRD nerve paralysis. Iliac artery embolism. Immune thrombocytopenia. Immune-mediated adverse reaction. Immune-mediated cholangitis. Immune-mediated cholestasis. Immune-mediated cytopenia. Immune-mediated encephalitis. L-immune-mediated encephalopathy. Immune-mediated endocrinopathy. Immune-mediated enterocolitis. Immune-mediated gastritis. Immune-mediated hepatic disorder. Immune-mediated hepatitis. Immune-mediated hyperthyroidism. Immune-mediated hypothyroidism. Immune-mediated myocarditis. Immune-mediated myositis. Immune-mediated nephritis. Immune-mediated neuropathy. Immune-mediated pancreatitis. Immune-mediated pneumonitis. Immune-mediated renal disorder. Immune-mediated thyroiditis. L-immune-mediated uveitis. Immunoglobulin G4-related disease. Immunoglobulins abnormal. Implant site thrombosis. Inclusion body myositis. Infantile genetic agranulocytosis. Infantile spasms. Infected vasculitis. Infective thrombosis. Inflammation. Inflammatory bowel disease. Infusion site thrombosis. Infusion site vasculitis. Injection site thrombosis. Injection site urticaria. Injection site vasculitis. Installation site thrombosis. Insulin autoimmune syndrome. Interstitial granulomatous dermatitis. Interstitial lung disease. Intracardiac mass. Intracardiac thrombus. Intracranial pressure increased. Intrapericardial thrombosis. Intrinsic factor antibody abnormal. Intrinsic factor antibody positive. IPEX syndrome. Irregular breathing, Irvin syndrome. Fourth nerve paralysis. Fifth nerve paralysis. JC polyomavirus test positive. JC virus CSF test positive. Jeevan syndrome. Jugular vein embolism. Jugular vein thrombosis. Juvenile idiopathic arthritis. Juvenile myoclonic epilepsy. Juvenile polymyositis. Juvenile psoriatic arthritis. Juvenile spondyloarthritis. Kaposi sarcoma inflammatory cytokine syndrome. Kawasaki's disease. Kayser-Fleischer ring. Keratoderma bleneragica. Ketosis prone diabetes mellitus. Countess syndrome. Lafora's myoclonic epilepsy. Lamel's excrescences. Laryngeal dyspnea. Laryngeal edema. Laryngeal rheumatoid arthritis. Laryngospasm. Laryngotracheal edema. Latent autoimmune diabetes in adults. Lascelles present. Lemierre syndrome. Lennox-Gastaut syndrome. Leucine aminopeptidase increased. Leukoencephalomyelitis. Leukoencephalopathy. Leukopenia. Leukopenia neonatal. Lewis-Sumner syndrome. Alhermides sign. Lichen planopilaris. Lichen planus. Lichen sclerosis limbic encephalitis. Linear IgA disease. Lipedema. Lip swelling. Liver function test abnormal. Liver function test decreased. Liver function test increased. Liver induration. Liver injury. Liver iron concentration abnormal. Liver iron concentration increased. Liver opacity. Liver palpable. Liver sarcoidosis. Liver scan abnormal. Liver tenderness. Low birth weight baby. Lower respiratory tract herpes infection. Lower respirator tract infection. Lower respiratory tract infection viral. Lung abscess. Lupoid hepatic cirrhosis. Lupus cystitis. Lupus encephalitis. Lupus endocarditis. Lupus enteritis. Lupus hepatitis. Lupus myocarditis. Lupus myositis. Lupus nephritis. Lupus pancreatitis. Lupus pleurisy. Lupus pneumonitis. Lupus vasculitis. Lupus-like syndrome. Lymphocytic hypophysitis. Lymphocytopenia neonatal. Amphopenia. Magic syndrome. Magnetic resonance imaging liver abnormal. Magnetic resonance proton density fat fraction measurement. Molar sign. Manufacturing laboratory analytical testing issue. Manufacturing materials issue. Manufacturing production issue. Marburg's variant multiple sclerosis. Marchia-Fava bigamy disease. Marine Lennox syndrome. Mastocytic enterocolitis. Maternal exposure during pregnancy. Medical device site thrombosis. Medical device site vasculitis. Mellis syndrome. Meningitis. Meningitis aseptic. Meningitis herpes. Meningoencephalitis herpes simplex neonatal. Meningoencephalitis herpetic. Meningomyelitis herpes. MERS-CoV test. MERS-CoV test negative. MERS-CoV test positive. Mesangia proliferative glomerulonephritis. Mesenteric artery embolism. Mesenteric artery thrombosis. Mesenteric vein thrombosis. Metapneumovirus infection. Metastatic cutaneous Crohn's disease. Metastatic pulmonary embolism. Microangiopathy. Microembolism. Microscopic polyangiitis. Middle East respiratory syndrome. Migraine-triggered seizure. Miliary pneumonia. Miller-Fisher syndrome. Mitochondrial aspartate aminotransferase increased. Mixed connective tissue disease. Model for end-stage liver disease score abnormal. Model for end-stage liver disease score increased. Molar ratio of total branched-chain amino acid to tyrosine. Molybdenum cofactor deficiency. Monocytopenia. Mononeuritis. Mononeuropathy multiplex. Morphoid. Morvan syndrome. Mouth swelling moya disease. Multifocal motor neuropathy. Multiple organ dysfunction syndrome. Multiple sclerosis. Multiple sclerosis relapse. Multiple sclerosis relapse prophylaxis. Multiple subfield transection. Multisystem inflammatory syndrome in children. Muscular sarcoidosis myasthenia gravis. Myasthenia gravis crisis myasthenia gravis neonatal. Myasthenic syndrome. Myelitis. Myelitis transverse. Myocardial infarction. Myocarditis. Myocarditis post-infection. Myoclonic epilepsy. Myoclonic epilepsy and ragged red fibers. Myocmia. Myositis. Narcolepsy. Nasal herpes. Nasal obstruction. Necrotising herpetic retinopathy. Neonatal Crohn's disease. Neonatal epileptic seizure. Neonatal lupus erythematosus. Neonatal mucocutaneous herpes simplex. Neonatal pneumonia. Neonatal seizure. Nephritis. Nephrogenic systemic fibrosis. Neuralgic ametrophy. Neuritis. Neuritis cranial. Neuromyelitis optica pseudo-relapse. Neuromyelitis optica spectrum disorder. Neuromyotona. Neuronal neuropathy. Neuropathy peripheral. Neuropathy ataxia retinitis pigmentosa syndrome. Neuropsychiatric lupus. Neurosarcoidosis. Neutropenia. Neutropenia neonatal. Neutropenic colitis. Neutropenic infection. Neutropenic sepsis. Nodular rash. Nodular vasculitis. Non-infectious myelitis. Non-infective encephalitis. Non-infective encephalomyelitis. Non-infective ophiritis. Obstetrical pulmonary embolism. Occupational exposure to communicable disease. Occupational exposure to SARS-CoV-2. Ocular hyperemia. Ocular myasthenia. Ocular pemphigoid. Ocular sarcoidosis. Ocular vasculitis. Oculofacial paralysis. Edema. Edema blister. Edema due to hepatic disease. Edema mouth esophageal achalasia. Ophthalmic artery thrombosis. Ophthalmic herpes simplex. Ophthalmic herpes zoster. Ophthalmic vein thrombosis. Optic neuritis. Optic neuropathy. Optic paraneuritis. Oral herpes. Oral lichen planus. Oropharyngeal edema. Oropharyngeal spasm. Oropharyngeal swelling. Osmotic demyelination syndrome. Ovarian vein thrombosis. Overlap syndrome. Pediatric autoimmune neuropsychiatric disorders associated with streptococcal infection. Paget-Schroeder syndrome. Palindromic rheumatism. Palizated neutrophilic granulomatous dermatitis. Palmoplantar keratoderma. Palpable purpura. Pancreatitis. Panencephalitis. Papillophlebitis. Paracancerous pneumonia. Paradoxical embolism. Parainfluenzae viral laryngotracheobronchitis. Paraneoplastic dermatomyositis. Parenchyplastic pemphigus. Parenchyplastic thrombosis. Persis cranial nerve. Parietal cell antibody positive. Paroxysmal nocturnal hemoglobinuria. Partial seizures. Partial seizures with secondary generalization. Patient isolation. Pelvic venous thrombosis. Pemphigoid. Pemphigus. Penile vein thrombosis. Pericarditis. Pericarditis lupus. Peripatic discomfort. Periorbital edema. Periorbital swelling. Peripheral artery thrombosis. Peripheral embolism. Peripheral ischemia. Peripheral vein thrombus extension. Periportal edema. Peritoneal fluid protein abnormal. Peritoneal fluid protein decreased. Peritoneal fluid protein increased. Peritonitis lupus. Pernicious anemia. Petit mal epilepsy. Pharyngeal edema. Pharyngeal swelling. Pityriasis lichenoides et varioliformis acuta. Placenta pravia. Pluriparenchymal fibroelastosis. Pneumabilia. Pneumonia. Pneumonia adenoviral. Pneumonia cytomegaloviral. Pneumonia herpes viral. Pneumonia influenzal. Pneumonial measles. Pneumonia mycoplasmal. Pneumonia necrotising. Pneumonia parainfluenzae viral. Pneumonia respiratory syncytial viral. Pneumonia viral. Poems syndrome. Polyarteritis nodosa. Polyarthritis. Polychondritis. Polyglandular autoimmune syndrome type 1. Polyglandular autoimmune syndrome type 2. Polyglandular autoimmune syndrome type 3. Polyglandular disorder. Polymicrogyria. Polymyalgia rheumatica. Polymyositis. Polyneuropathy. Polyneuropathy idiopathic progressive. Portal pyemia. Portal vein embolism. Portal vein flow decreased. Portal vein pressure increased. Portal vein thrombosis. Portospulmonocenteric venous thrombosis. Post-procedural hypotension. Post-procedural pneumonia. Post-procedural pulmonary embolism. Post-stroke epilepsy. Post-stroke seizure. post-thrombotic retinopathy, post-thrombotic syndrome, post-viral fatigue syndrome, postictal headache, postictal paralysis, postictal psychosis, postictal state, postoperative respiratory distress, postoperative respiratory failure, postoperative thrombosis, postpartum thrombosis, postpartum venous thrombosis, postpericardiotomy syndrome, post-traumatic epilepsy, postural orthostatic tachycardia syndrome, precervical artery thrombosis, preeclampsia, preictal state, premature labor, premature menopause, primary amyloidosis, primary biliary cholangitis, primary progressive multiple sclerosis, procedural shock, proctitis herpes, proctitis ulcerative, product availability issue, product distribution issue, product supply issue, progressive facial hemiatrophy, progressive multifocal leukoencephalopathy, progressive multiple sclerosis, progressive relapsing multiple sclerosis, prosthetic cardiac valve thrombosis, pruritus, pruritus allergic, C. vasculitis, psoriasis, psoriatic arthropathy, pulmonary amyloidosis, pulmonary artery thrombosis, pulmonary embolism, pulmonary fibrosis, pulmonary hemorrhage, pulmonary microemboli, pulmonary oil microembolism, pulmonary renal syndrome, pulmonary sarcoidosis, pulmonary sepsis, pulmonary thrombosis, pulmonary tumor thrombotic microangiopathy, pulmonary vasculitis, pulmonary veno-occlusive disease, pulmonary venous thrombosis, pyoderma gangrenosum, piostomatitis vegetans, pyrexia, quarantine, radiation leukopenia, radiculitis brachial, radiologically isolated syndrome, rash, rash erythematus, rash pruritic, Ras muscle encephalitis, Raynaud's phenomenon, reactive capillary endothelial proliferation, relapsing multiple sclerosis, relapsing remitting multiple sclerosis, renal amyloidosis, renal arteritis, renal artery thrombosis, renal embolism, renal failure, renal vascular thrombosis, renal vasculitis, renal vein embolism, renal vein thrombosis, respiratory arrest, respiratory disorder, respiratory distress, respiratory failure, respiratory paralysis, respiratory syncytial virus bronchiolitis, respiratory syncytial virus bronchitis, retinal artery embolism, retinal artery occlusion, retinal artery thrombosis, retina vascular thrombosis, retinal vasculitis, retinal vein occlusion, retinal vein thrombosis, retinobinding protein decreased, retinopathy, retrograde portal vein flow, retroperitoneal fibrosis, reversible airways obstruction, Reynolds syndrome, rheumatic brain disease, rheumatic disorder, rheumatoid arthritis, rheumatoid factor increased, rheumatoid factor positive, rheumatoid factor quantitative increased, rheumatoid lung, rheumatoid neutrophilic dermatosis, rheumatoid nodule removal, rheumatoid scleritis, rheumatoid vasculitis, saccadic eye movement, Sappho syndrome, sarcoidosis, SARS-CoV-1 test, SARS-CoV-1 test negative, SARS-CoV-1 test positive, SARS-CoV-2 antibody test, SARS-CoV-2 antibody test negative, SARS-CoV-2 antibody test positive, SARS-CoV-2 carrier, SARS-CoV-2 sepsis, SARS-CoV-2 test, SARS-CoV-2 test false negative, SARS-CoV-2 test false positive, SARS-CoV-2 test negative, SARS-CoV-2 test positive, SARS-CoV-2 viremia, Seidoyoshi syndrome, schizencephaly, scleritis, sclerodactylia, scleroderma, scleroderma-associated digital ulcer, scleroderma renal crisis, scleroderma-like reaction, secondary amyloidosis, secondary cerebellar degeneration, secondary progressive multiple sclerosis, segmented hyalinizing vasculitis seizure, seizure anoxic, seizure cluster, seizure-like phenomena, seizure prophylaxis, sensation of foreign body, septic embolus, septic pulmonary embolism, severe acute respiratory syndrome, severe myoclonic epilepsy of infancy, shock, shock symptom, shrinking lung syndrome, shunt thrombosis, silent thyroiditis, simple partial seizures, Sjogren syndrome, skin swelling, psoas arthritis, smooth muscle antibody positive, sneezing, spinal artery embolism, spinal artery thrombosis, splenic artery thrombosis, splenic embolism, splenic thrombosis, splenic vein thrombosis, spondylitis, spondyloarthropathy, spontaneous heparin-induced thrombocytopenia syndrome, status epilepticus, Stevens-Johnson syndrome, stiff leg syndrome, stiff person syndrome, stillbirth, Still's disease, stoma site thrombosis, stoma site vasculitis, stress cardiomyopathy, stridor, subacute cutaneous lupus erythematosus, subacute endocarditis, subacute inflammatory demyelinating polyneuropathy, subclavian artery embolism, subclavian artery thrombosis, subclavian vein thrombosis, sudden unexplained death in epilepsy, superior sagittal sinus thrombosis, Sussac's syndrome, suspected COVID-19, swelling, swelling face, swelling of eyelid, swollen tongue, sympathetic ophthalmia, systemic lupus erythematosus, systemic lupus erythematosus disease activity index abnormal, systemic lupus erythematosus disease activity index decreased, systemic lupus erythematosus disease activity index increased, systemic lupus erythematosus rash, systemic scleroderma, systemic sclerosis pulmonary, tachycardia, tachypnea, Takayasu's arteritis, temporal lobe epilepsy, terminal ileitis, testicular autoimmunity, throat tightness, thromboangiitis obliterans, thrombocytopenia, thrombocytopenic purpura, thrombophlebitis, thrombophlebitis migrans, thrombophlebitis neonatal, thrombophlebitis septic, thrombophlebitis superficial, thromboplastin antibody positive, thrombosis, thrombosis corpora cavernosa, thrombosis in device, thrombosis mesenteric vessel, thrombotic cerebral infarction, thrombotic microangiopathy, thrombotic stroke, thrombotic thrombocytopenic purpura, thyroid disorder, thyroid stimulating immunoglobulin increased, thyroiditis, tongue amyloidosis, tongue biting, tongue edema, tonic-clonic movements, tonic convulsion, tonic posturing, topectomy, total bile acids increased, toxic epidermal necrolysis, toxic leukoencephalopathy, toxic oil syndrome, tracheal obstruction, tracheal edema, tracheobronchitis, tracheobronchitis mycoplasmal, tracheobronchitis viral, transaminosis abnormal, transaminosis increased, transfusion-related alloimmune neutropenia, transient epileptic amnesia, transverse sinus thrombosis, trigeminal nerve paralysis, trigeminal neuralgia, trigeminal palsy, truncus coeliacus thrombosis, tuberous sclerosis complex, tubulointerstitial nephritis and uveitis syndrome, tumefactive multiple sclerosis, tumor embolism, tumor thrombosis, type 1 diabetes mellitus, type 2 hypersensitivity, type 3 immune complex mediated reaction, Althoff's phenomenon, ulcerative keratitis, ultrasound liver abnormal, umbilical cord thrombosis, uncinate fits, undifferentiated connective tissue disease, upper airway obstruction, urine bilirubin increased, urobilinogen urine decreased, urobilinogen urine increased, urticaria, urticaria papular, urticarial vasculitis, uterine rupture, uveitis, vaccination site thrombosis, vaccination site vasculitis, vagus nerve paralysis, varicella, varicella keratitis, varicella post-vaccine, varicella zoster gastritis, varicella zoster esophagitis, varicella zoster pneumonia, varicella zoster sepsis, varicella zoster virus infection, vasa pravia, vascular graft thrombosis, vascular pseudonerism thrombosis, vascular purpura, vascular stent thrombosis, vasculitic rash, vasculitic ulcer, vasculitis, vasculitis gastrointestinal, vasculitis necrotising, vena cava embolism, vena cava thrombosis, venous intravasation, venous recanalization, venous thrombosis in pregnancy, venous thrombosis limb, venous thrombosis neonatal, vertebral artery thrombosis, vessel puncture site thrombosis, visceral venous thrombosis, Vith nerve paralysis, Vith nerve paralysis, vitiligo, vocal cord paralysis, vocal cord paralysis, Vogt Koyanagi Harada disease, warm type hemolytic anemia, wheezing, white nipple sign, 11th nerve paralysis, X-ray hepatobiliary abnormal, Young syndrome, Zika virus associated Guillain-Barré syndrome,